Hello, and welcome to NCQA's HOQ Users Training Review. I'm Michelle Taylor, one of the NCQA HEDIS account managers, and I'll be your guide through this recorded demonstration, where we'll be taking a detailed look at the complete HOQ process, section by section, providing what we hope you will consider to be helpful hints and tips. Okay, let's get started. Healthcare Organization Questionnaire, the HOQ. What is it? Well, it's a web-based questionnaire where organization, plan contact, and product line, which would include the enrollment and state licensure, information is collected. It's used to request submission IDs that are required to report HEDIS data to NCQA. Your submission IDs will be made available in the IDSS in April when it's released. Also, demographic and performance data that are collected in HOQ and IDSS are used for all of NCQA products. So that would be your quality compass, state of healthcare quality, and the health plan ratings. This slide shows us our data collection timeline for 2018. We've included the link just in case you need to see the full timeline. But for now, we're going to go through these months and just go through the high points. Of course, January, we released the HOQ. And then from that point until February the 16th, we'll be going through our approval process. Also want to note that the CAHPS and QHP validations need to be completed by January the 29th. Also, February the 16th is the deadline this year. Everything needs to be marked final by 11:59 Eastern Standard Time on February the 16th. In March, we'll be sending out a customer survey. We ask that you please take a look out for that. We've made so many changes to the HOQ, and we want to get your feedback. So if you could please plan to participate in the survey, we would be very much appreciative. In April, we'll be releasing the IDSS. And then in June, the plan lock date has moved. Your plan lock must be applied by June the 1st. And then the deadline, final deadline for all product lines, everything marked final and done, is June the 15th at 11:59 Eastern Standard Time. What's new for 2018? Well, we are excited and happy to announce that we have moved the HOQ system, the total system, over to a brand new, or what we hope you will consider, more user-friendly format. Along with a new system, we have a couple of new terms and sections that we just wanted to make you aware of before you go looking at the tool. Under the organization identification section, we've added new questions in regards to your legal entity and the name of your organization, as well as a question in regards to your financial status for your organization. Those questions are required. So you would have to answer those before you can go any further in completing your HOQ. For the Medicaid scoring component, we've added to the submission request listing, your CAHPS scoring component will be listed so that you can see what was selected for your CAHPS scoring. And so hopefully that'll help with any confusion that you might have as to what type of surveys need to be completed in order to make sure your CAHPS scoring component is taken care of. For marketplace enrollment, under the product tab, we've added some new questions in regards to the enrollment. Of course, these questions are required. And so once you answer those, it will take you on through the system so that you can update your product information for your marketplace plans. Just a little clarification on the CAHPS and QHP survey sample frame process. Process starts with the plan sending the survey sample frame to the auditor. The auditor then applies their lock. They validated it and apply the lock. Then the plan will then send that auditor lock survey sample frame to their vendor. Once HOQ is open, the plan then updates and requests the subs in the HOQ, and then they give the auditor access to those subs so that the auditor can then go in and enter their survey sample frame results in HOQ. Once that's done, anytime before or on February the 16th, the plan can go in and mark their HOQ final. All right, we have here a couple of points we wanted to bring out about the CAHPS scoring and the QHP enrollment survey components. For Medicaid, the organizations are given the option to choose which CAHPS component they want to use for scoring and to be used in the NCQA reporting programs. This will be on the products tab in the new HOQ. And of course, when we go through the demonstration, I'll show you what that looks like. Also, with that CAHPS scoring component, once it's been selected and your HOQ has been marked final, you will not be allowed to make any changes to that selection. So please, before you mark final, double check, triple check to make sure that this is the scoring component that your organization wants to use. For the marketplace QHP submissions, the QHP enrollee survey section is actually defaulted, so you don't have to make any selections or changes to that section. You do, however, have to get your auditor's approval, so you have to give them access to that submission. They have to do their approval before you can mark final. We've noted that we've had some problem areas or some questioned areas in the HOQ in the past, and so we want to take an opportunity to try to see if we can clear some of those things up for you. Those areas would be our special area, special product, none, what that means and how to use that. The differences between the selection of CAHPS scoring components and the selection of your CAHPS for your submissions. The next section would be completing shared submissions. And then last but not least, choosing the correct submission field types. We're going to go through those and hopefully clear a couple of things up for you in our next slide. Okay, so we're starting with our special area, special products, what we call none. So here on the slide, we're looking at an example of one organization with two submissions for the same reporting product line and reporting product. First one we have is one with both a special product and a special area. Now, it can be one or both, but as long as there is a special project or a special area, this would represent a subset of the Medicaid population. Then under that submission is the next one, what we have as the none. There's no special product or no special area selected. They're both set at none. This submission would include the total Medicaid population, which would include the subset that's listed in the submission above. So when we see at NCQA, when we see a submission that's Medicaid, no special project, no special area, we automatically think it's the default of the total Medicaid population. So you want to keep that in mind when you're working with your submissions there. The CAHPS scoring component versus the CAHPS submissions, basically the differences between selecting scoring components and selection for submission. A scoring component is actually selected in the product section, and that's going to be used for scoring and our NCQA programs. Now, each submission can have up to two types of CAHPS surveys. You can have adult and child, or adult with child and child CCC, or a single survey, just adult, just child, or just child with CCC. You can never put two child submissions together. It's going to be one or the other. The scoring component section or selection survey must be requested in one of your corresponding submissions. Now, you can add other surveys to that, but the corresponding selection has to be requested in order for you not to receive an error message. For our shared submissions, basically this is two legally separate organizations that share data. One's going to submit the data and the other will not. So of course the one that's submitting the data will request the submission as usual. The organization that's sharing that data will not request any submissions, but their HOQ must be completed. Now in the HOQ, the submission page is going to list a shared submission that cannot nor should it be requested. You'll need to complete all sections in the HOQ, and then you can basically just skip the submissions page. The system will know that you have a shared sub, so it will allow you to mark final without any errors. Our last section, the submission field types. Generally, we had to make many changes in this field for organizations, and what you pull up in the HOQ may be different from what you actually selected last year. You can change it back, but generally, if we changed it before, we're going to have to change it again because it doesn't fit the criteria for the area that you selected. If you have any questions about that and what was selected or changed, please contact your account manager so we can let you know why we made the changes and have whatever discussion we need to have to make sure we do select the correct type for your submission. In general, the NCQA programs is the selection that should be made. It's used for NCQA products and accreditation, but it can also be used for state submissions. So if you have a submission that has to go to the state, and that's the only submission that you're doing, you don't want to select state. You want to select NCQA programs. We'll use it in our programs, and we'll also give that data to your state. Now, for state submissions, that basically is submissions that are for state or county only, not to be used with the NCQA programs. The other type is for internal use for your organization or federal programs or any other purpose outside of NCQA. So, anything that does not apply to the other two NCQA programs or state would be an other. And hopefully that gives a little bit of clarification. And if you have any questions about any of this, please do not hesitate to contact your account manager. We'll be happy to go over this information with you. Now, let's go on to the demonstration. So, welcome to our brand new NCQA applications online page. It's a brand new phase for the HOQ, quite different from IDSS now, so don't have to worry about being confused between the two. We just want to mention that your old links to the HOQ will no longer work. You can use the link that was sent in the kickoff email, or you could enter through the My NCQA portal. So to log in, you would actually just click on the sign in link up here at the top. That's going to take you to the login page. Now, just to remind you, your user ID will always be your email address. If you are a new user or you don't remember your password, you simply just click on the Forgot Password link. That's going to bring up our NCQA password assistance box. You put in your email, you prove that you're not a robot, click on continue, and the system will send you an email. Now, if you don't receive an email within about 15 minutes or so, there are two things you want to keep in mind. Primary contacts are the only ones that are initially given access or rights to the system. If you are the primary and cannot gain access, you will need to contact your NCQA account manager. If you are not the primary HEDIS contact, you will need to contact whoever it is in your organization that is the primary contact and get them to give you access that you need. So I'm going to go on here. And we're going to go ahead and log in. Once we log in, it's bringing us to the main page, which has a lot of information. But we do want to point out that this page is currently the login page for both the accreditation application and the HOQ. So if your plan is currently in the process of going through accreditation and you have access to those applications, you will see them listed here under step 2 along with the HOQ. We also want to mention that the roles and permissions for HOQ are exactly the same as they were last year. And so the primary HEDIS contact is still the one responsible for all access for your organization to the plans within the HOQ. So we're going to take a look at this, the main page here. We have a header menu bar up top. The link that works here is the applications link. This will be on every page that you're in once you're into the tool. Applications link will take you right back to this very page. So if you're ever at any point you want to come back to this page, you just click up here at the top on applications and it will bring you right back here. And then of course we have our log out link there that will let you log back out of the system. Also, we have the walkthrough video that you're looking at right now. Currently on this page right now, we have the 2017, but it will be updated by the time you see this video. Uh, and then at the bottom of the page, you'll notice there are some things. I have another question I don't see. These things really are for the accred portion of the application. Uh, if you want to get in touch with your account managers, uh, it's better to go into the HOQ, and then there are additional things there where you, if you have a question, you can click on, and the email will come directly to us as your account manager, and we can help you quickly that way. So let's get started by going through the tool itself. Let's start with step one. Okay, so step one, select an organization. There are a couple things on this section that you want to take a look at. If you have multiple organizations, they're all going to be listed here, of course, and you can decide how many you want to see at a time. I only have 5, so it's only going to show 5, but you can do 10, 25, 50, up to 100 organizations at a time. You can also search for your organization by name or by org ID number, and you would just type in whatever part of the name, and I did that wrong. Do IDSS, and that org comes up. You can also sort by org ID number or by organization name or your actual location and applications. So for applications, it's going to show you for the HOQ, if it's in process, if it's not, if it's marked final, all of that will list here. And if you have different states where your organizations are located, you can sort by that as well. We do want to mention that if you do not see your organization listed and you're the primary HEDIS contact, or if you have a brand new organization that you want to add to the system, in both cases, you're going to need to contact your HEDIS account manager if you are the primary HEDIS contact. If you are not the primary, you need to contact your primary and let them know that you're missing an organization so they can give you access to that. Um, and other than that, that's the end of this little section. And we're going to move on to our next section, which is our step two. Okay, step two, review and edit your applications. We do want to know, just as we said previously, if your organization is undergoing anything in the accred process, you will see those accreditation applications, if you have access to those or rights to those, listed here along with your HOQ. We also want to point in the step two section, we have a link that will take you to the complete user's guide for HOQ. Um, and but we want to actually show you a couple of shortcuts in the tool. So we'll show you that once we go into the HOQ. Um, Here, what you see is the HOQ itself, and it has the status, and it also has the last date modified listed. Now, when you select your organizations, what you'll see is the name also changes up at the top, and then your status will change. So if I go to the next org here, you can see that that hasn't started yet. And when you first log in, this is what you'll see. It'll say not started. So we're going to select our organization by highlighting it, and then we're just going to click on continue. This is going to take us to the HOQ for this organization, as you can see the name up at the top. But before we get into the actual steps within the HOQ, we just want to point out our help section over here. This tab will appear on each one of the tabs that we have, all 7. And when you click on the help section, what happens is it automatically goes to the instructions for the section that you're currently in. So instead of having to kind of figure out what part of the HOQ you want to go to, you click on the help button, and it takes you directly to the section that you're working in. Also, we want to go to the bottom of the page and check out the menu that will appear at the bottom of all of the pages once you get into the HOQ tool. If you are an admin user, you will see the link for the HOQ Users Management. Everyone will also see the Ask a Question, which if you click on that link, it opens up that box. Can submit your question and it will go directly to your account manager. So close that. We also have the FAQs. And then there's a blog, terms of use, which we saw when we came into the tool, and about NCQA, and then a link to take you to our home webpage. So we're going to take a look at the HOQ management tool, which, as we said, will only be available to the org admin users. Generally, this is your primary HEDIS contact. Once you click on that link, it says, do you want to leave? And of course we do, because we want to take a look at our users. Once we are there, what we see is a list of all users that are assigned to the organizations that you are the admin user for. All the users from last year have not been removed from the system, so we do recommend that the primary look over the list of users and make sure they all should have access to the organization. With our update, we've made it so that there is only one way to update and manage your users for all types of users, be it auditor or a regular user within your organization. And so we'll just briefly go through how to add a user. Then, but before we start that, I'm sorry. The new tools that we have, if you have numerous users, you can select how many users you want to see at once, from 10 to 100. You can also now search for a user using an email address. So we can pull up my email addresses, they're listed there. Now, to add a new user, we simply would just go and click on the button, Add New User. And what happens is it's asking for their email address. Email address, of course, is going to be their user ID. Before you add a new user, we do want to point out that you should search for them in the system to make sure they're not there. Secondly, every user that is in the HOQ, in order to access the HOQ, has to have an account set up in the My NCQA portal. In order to access a tool, you have to have an account under My NCQA. So you might want to check with the users to make sure that they're using, if they already have an account, that they are using the same email address that you'll be putting into the system, because if they don't match up, they won't have access. So we're just going to add a new user. Once you do that, that's the email address. You can start selecting your user role. Now, users should not have dual roles, so they can't be an auditor and a user for an organization. So what we've done is, once you select the type of user you want them to be, you hit add, you'll see for the other type of role, that organization will disappear. So you can select one by one, you can shift and highlight, add them all. And once you do that, you just save changes. And that is all there is to giving someone access to your orgs. Now, if you want to make some changes, as you can see, the person was added to my list now. And I didn't point out that you can actually sort in alphabetical order for the email addresses to make things easier for you as well. But for the user I just added, if I wanted to make some changes, I just simply click on Modify. Once I do that, their assignments come down, and I can say I didn't mean to set them up as a user. They're an auditor. So what I can do is I can remove them one by one, or I can highlight them all with the Shift key to remove them, and then go down and give them access. They're my auditor, so I'm going to add that. Save changes. And they've been updated. Now, let's say that I have someone that no longer works for the company or they moved on or whatever. I want to remove their access to my organization. So to do that, I would simply just click on the arrow, remove all HOQ roles. And it says this will remove the roles from the user. Are you sure you want to proceed? This can't be undone. And the thing is, you can say yes. It will not remove the user from your organization listing right away. And it does not remove them from our system, but it does take away their access to all of your organizations. It goes back to blank. Okay. And that is the simplicity of our new users management section. Now, to get back to the organization HOQ that you were just in, if that's what you want to do, you just simply click your back arrow in your browser, and that's going to take you right back to your HOQ for that organization. So now let's go through our step one. Step one, organization identification. So we have a couple of new questions that we took a look at in our slide presentation, and they're listed right here. When you first come in, they'll probably be red because they haven't been answered yet, and you have to answer these questions that is required. And there are questions about your legal entity, your name. Has that legal entity changed or the name changed? If you say that they're not the same, it'll have you contact us, your account manager, so we can make sure we get things corrected before you go any further. If they're the same, you would say same. And then we have a question about your financial status for your organization. Since the last submission, has this organization filed for bankruptcy or liquidation, or has it been placed under supervision or receivership? If the answer to that question is yes, and you are an accredited organization, you would have to click this link to send an email because that is a reportable event. And as an accredited organization, you do have to report those events to us. But for the sake of this review, we're just going to say no. And we're going to move on. Now, the other thing, and new thing that we want to point out, that for each of your HOQs, your assigned NCQA HEDIS account manager's name will be listed here so that you have no question as to who you need to contact should you have any questions or need anything. Now, you can make any type of updates that need to be made within the org. And we make that update. And as you can see, it does our billing address. If it's supposed to be different, you can just uncheck that box and put the correct one in. But we're just gonna check everything, make sure everything's okay. And then we would save changes. But I forgot to point out uh, your org ID name. You can't make changes to it. Your org ID is listed as well as at the top of the page. So I just wanted to point those out. If you have any questions about what we mean by certain things, what you'll see are these little question marks here. And if you just hover over them, they will tell you what we mean for these sections. So we've updated everything. Things are good. So we're going to change our type. Organization type, it is actually an MCO. And now we're going to save our changes. As you can see, the green section comes up to let you know that your information has been saved. So you're actually finished with this page and you can move on to the next. You can do that two ways, clicking at the tab at the top or at the arrow. So we're going to go ahead and we'll just click our arrow and go to our next section, which is roles and contacts. Okay, step two, tab two, roles and contacts. There have been some major changes to how we assign and update uh, our roles and contacts. So hopefully we've made it a lot easier for you. We'll start with our active contacts. What we can see is a list of everyone that we've added to the system and whether or not they have a role, how many roles they have assigned to them will be listed here. Um, if you want to update a person's information, someone got married, or if their phone number changed, email changed, whatever, you would simply just go and click on edit. Once you do that, it brings up that person's information. And what we see is we want to use the billing address in the system to update that. And their titles listed there, credentials, they're an MD, so we want to put that in as well. We selected that. That's done. Their phone number, if you have an extension for them, put that in if there's an extension. Anything else that needs to be updated, you update here and you just save and close. That person's information's been updated. Uh, if you want to inactivate someone, they're no longer with the organization, you just simply just click on the arrow and you're going to click on inactivate. Wants to make sure that you want to do that, you say yes. And what you can see is that person has been moved down to the bottom. Now, if you need to activate them again, you would just simply click on the activate and it would move them back up to the top. And there they are. So then we're going to edit and give them a real name. Well, we can't give them a real name. The name stays the same. The first name, regardless of whatever it is, it's going to be in the system. The only thing that can change, because this is that person's record, the only thing that can change is the last name, and that's just in case they were married or divorced or whatever, that last name change can be updated. So we're going to discard, and we want to remove this person. Yes. So they're inactive. Now, basically, if you need to add a new person, you just simply click on New Contact, and you're going to put in new information. And their title. And as you can see, things that are required have a little star beside them. If I was to try to not fill that out, you would get the instant error message and know that you need to complete that. So title is, and their email address, and their address. Now, if this person is at a different address besides the organization address, you would simply just type it in here, or you can just click on Use Organization Billing Address, and it'll automatically update that. Phone number is required. And then we can add an extension. Once everything is the way it needs to be, we save and close. And as you can see, the person is listed here, but they don't have any roles assigned. Now, to assign roles, it's as simple as going to that role and getting to the drop down box, and everyone that's active will appear in this box. You simply just click on their name and they have been updated. You need to add someone else. You can go through and select and change all of your roles just by going through the drop downs. And that's all there is to updating, which is helpful for those that have same people in different roles. You don't have to change each and every one. You just go through and do your drop downs. And you just simply click on Save Changes. That's been updated. And once we're finished with this section, which we are, we just simply can go to the next section, which is tab 3 for our products.
Okay, on to step 3, tab 3. Uh, we want to mention here this is your products and it's your current product lines and products. So this is only going to display the products that we currently have listed for your organization that have enrollment under them. If there's a new product that you need to add, you will simply just go through the new product adding, which I'll show you shortly. But I want to point out that you will still need to update each product line enrollment information as of 12/31, 2017. If you are submitting data on a subset of a population of any of the product lines, when you get to this section, you just pick that product line itself, if it's commercial, HMO, whatever it is, and you combine all of the products enrollment here. So it wouldn't be, you might have 4 different submissions, but here you're just doing the product line. So you just do the enrollment for the entire product. And then when you get to requesting your submissions, that's when you start splitting things up to show that they are subsets for that population. Now, for Medicaid, this is where you would select your CAHPS scoring component. So let's click on one. We have our Medicaid here, and this is what we have been updated with as of last year for this product. And so if we click on edit, what we'll see now, if you have know your group type or your profit status, you can select that there. And then we have the CAHPS component to be scored. Generally, when you come in, this will be red because it needs to be updated. And so you would just go through the drop down and tell us which CAHPS component you want scored or used for scoring for your organization. And you're going to go ahead and select whichever one you want. If it's child CAHPS or adult CAHPS, you click that. And then it's a reminder here letting you know that, once this is marked final, the HOQ is marked final, you will not be able to make any changes to this CAHPS scoring selection. So please check and make sure that this is what you want to have scored. Now, what we see here is some totals. There's no, you don't update this. It just actually starts doing a running total so you can see the total amount of enrollment that we have for you as you update your states. Now, your states are listed by the license to operate. So for this section, you only enter those states in which you are licensed to operate in. You might have numbers all over the country, but if you're only licensed to operate in 2 states, you're only going to list 2 states here, and you'll combine or divide up um, those that population wherever they are in different states, and you'll just split them up between the states that you do have a license to operate in. So um, we're going to update our numbers here for our enrollment. And generally, your numbers would change for from year to year. So this is data that we collected last year, and we're going to update each one of those states. And if we needed to add an additional state, we would simply go through the drop down, pick the state that we needed. Let's say Delaware. Put the number in, and we simply click on hit the return first to lock that in, and then you hit your add. And now you can see that this is listed. If you are accredited, and these are supposed to be including your accreditation, you're going to mark those boxes. And then if you have any market names, you would put them down here. To add a new market name, you just simply click the box. And you go over and you click on your add button. And now that's listed. If you need to remove them, just simply click on remove and that's gone. Once you're done, You've updated everything. You click on Save and Close. And now it shows that that product has been updated. And just to go through the rest of them, just to show you, we have new questions for Marketplace. So all your Marketplace will have the added update required. It's required for everything. So um, you would go through and answer the questions. So the questions are, to the best of my knowledge, I can demonstrate my reporting unit had an enrollment status greater than 500 as of June 1st. So you have to answer that question. You had an enrollment status greater than 500 as of January 1st, 2018, and you answer that question. Now, if the answers are no to any of those, there'll be some instructions that you need to follow once you answer those. So we'll say yes, and then we're going to come down and we're going to update the numbers. We've updated our numbers, and as you can see, we have our 3 states, and the total enrollment has updated as I did that. Everything else is good, and so I'm going to save and close. Now once I do that, as you can see, my red marks have gone away. We've gone through and we've updated all of these, but I do want to let you take a look at what Medicare looks like in here as well. So for our Medicare, we have our information. We do point out that our Medicare CAHPS surveys are not collected by CMS, so you don't have to give us any information in regards to your surveys for Medicare. We do need your information in regards to your state's enrollment and your contract number, so your H contract numbers. If any of these change, if you need to remove or add, it's as simple as just clicking in the box, putting in your H contract number, and adding it. And if your market names are there, you have those. You save and close. Oh, do want to point out, if you have your S&P, MMP, those type of things, you're not going to show that here because we're just doing the product. This is one of those that we talked about in the beginning. You're doing your total Medicare population for the product line and reporting product. So if it's an HMO, all the HMOs are going to go here. If it's a POS, you'll do a Medicare POS, and your total enrollment for those will be listed there. So I'm going to save that. So we've updated all of our products. Now to say we needed a new product, we would simply just click on new product, and it's going to bring down our box. Now, according to what we have already listed, it's not going to just give us everything. If we already have a commercial listed, we have all the type of commercial plans that you can have already listed. So it's not going to be in my product line to pick. I would just update what I already have. For Medicare, what's available, what we don't have is Medicare PPO, POS, EOP. So we can't create a new Medicare HMO because there already is one. But I don't want to do a Medicare EPO. We'll do a new product, and we're going to make it Medicaid. And once that's in, you can see it's grayed out. You can't make any changes. If this was a mistake, you have to do as I did. You have to cancel and close and start again. So we're going to go to the product. Our product for Medicaid is going to be POS. And if you know your model type, you can put that in. Your profit status, if you know that, you put that in. And then, of course, because it's Medicaid, we have to select our CAHPS scoring component. And for this one, we do adult and our coverage area. So we're going to pick our states, put in our enrollment in, enter the add the add backs come up for us. If you made a mistake and that's not what you want and you want to go back, you can just hit the arrow box to clear if you have things in there you wanted to take out. But just to add, I'm going to put in Virginia, enrollment numbers. And so my 3 states are listed. My total enrollment is listed as well. And I'm going to go down and my market name. And I'm going to add that. And then I'm going to save and close. And as you can see, now I have my new Medicaid is listed here with my information. Now, if I had did that by mistake, or if there's a plan that or a product we're no longer offering, we would simply just click on the edit button, discontinue it by clicking the box here, and it lets us know. It means that a submission cannot be requested for this product because we're discontinuing it. That is correct. So we're going to save and close. And what happens is now we see that it's still here, but it says that it's discontinued. So anytime before you mark final, if this was a mistake, you simply would just come back, hit edit, unclick the discontinued box, update your information, and then save and close. And then that information is there with your total enrollment. Once you're done with this page, you just simply click save your changes, and then we can move to our next section, our fourth step of submissions.
Okay, moving right along to our submissions, tab 4, step 4. Uh, Listed here, once you get to this page, will be all the submissions that were requested last year, including any shared submissions if you have those. If you have multiples, you can decide how many you want to see at once by just clicking on how many you want to show. You can also search by putting in the sub ID number, and then you can sort. You can sort by your sub IDs, product lines, reporting product, and then as you go through and request your submissions, this requested submission list will be updated. So those that have been requested will show as a yes, and those that haven't will show as a no. We do want to mention that if you are brand new and haven't done any submissions as of last year, this section will be blank for you. So just get in and you'll just be requesting new submissions. Now, as always, if you are not making any changes to your submission components for the submissions that you did last year, you will not need a new submission. You will just simply request last year's submission for this year. If you are making any changes to components such as the special area or special project because you no longer cover members in a certain geographic region, you're actually going to have to request a brand new submission. Uh, but we want you to remember that you will not request the submission from last year. It's going to be brand new since your um, population changed. So, for requesting existing submissions, in order to keep the same submission ID, you're going to request a submission by actually just going to that submission and clicking on the arrow beside the sub ID. Once you do that, you'll see all the information here from last year. And to request it, you would simply just click on Request Submission. Once you do that, it's going to open up a page. you'll see that there's information that's grayed out. If any of the information that is grayed out needs to be changed, this means that you need a new submission and you won't be requesting this one, but you'll be requesting a new submission to replace this if any of this information needs to change. Um, and also, changes in submission IDs will affect trending and benchmarking. So you might want to talk to your account manager if you have questions about that, updates there. So we're in a marketplace submission and we have some new questions here for that. So is this our first year reporting this unit operational? So I'm going to say now we're going to pick our year to report. It's optional. We did it last year, so first year reporting we can say was last year or whatever that year was that the first time you reported was. You can put it there. And then the question is, has reporting unit been operational for 3 years, 2006, 17, and 18? So this would be a yes since we picked 2016. And then you can see that, yes, an audit is required, so you're going to have to put in whoever your vendor is. And then your measure logic, if you used one of our certified vendors, you want to pick them from this list. Yes, you need an IDSS, so we automatically put that in for you. And your QHP Enrollee survey. It's automatic. You don't have to worry about that, but you do have to say your survey vendor firm. You have to pick that group. Once you do that, you save and close, and as you can, before you save and close, you'll see that the survey sample frame has not been validated yet. And this is, once you update this and request a submission, then your auditor can go in and validate this for you. So you save and close that one. And as you can see, we had it sorted by yes or no. So this has moved to the yes level, and we see it here. And it's yes, and it's been requested. And it also will show, we show your requested subs on the same page now. So now you can see that it's down here as one of our requested submissions. And let's go through a few more just to show you what they look like. We're going to do this Medicaid, and it's a CAHPS only Medicaid submission. So we click on that and request the submission. The audit, is it required for this? Because it's CAHPS only, I'm going to say no. Our method used, I'm going to pick that. And our vendor there. Because it's CAHPS only, we don't need an IDSS, so we would say no. And then it shows us our CAHPS scoring component. We picked adult, so we have to make sure that adult is listed. So we're going to say yes, pick our vendor. They will do that now, whether you don't have to do CAHPS or you can do child CAHPS. We're going to say no to the regular child and yes to the CCC and put our vendor in. Now, all that's been updated, we save and close. And once again, it's been moved to the yes section. Let's take a look at a Medicare submission, a regular Medicare CMS population, which is going to be everyone, including if there's an S&P or the MMP population included, everybody would be included in this submission. We're going to request that sub, and it's a little bit different. We see the contract numbers grayed in. Yes, we need an audit. We have to pick our vendor. That's the vendor from last year. It's the same. We do have to say about our methods of doing our measures. And then, yes, we definitely need an IDSS. Now, Then we come down to the HOS. Are we doing an HOS for this survey? Of course, yes. And we're going to say whether or not we need a baseline, who's our vendor. Say no. Save and update. So now that's also been changed to yes. I just want to point out, just so you can see it, we do have a commercial. Commercial, you won't see, it's already been requested, so I would have to go down to the bottom, take a look at it. So my commercial, it's right here. And I'm going to edit it so you can see. I just want you to see with commercial, the only type of CAHPS that you can do is adult. So you won't see child anything down here for your commercial submissions. It's only going to give you child, and you can say yes or no, depending on whether or not you are doing a CAHPS survey for those. So we're going to close that. So now that I've gone through and done the submissions that I needed, oh, one more. Let's do the MMP. We're going to say yes. Everything's grayed out. Everything that we need is there. We just need to let them know who our vendor is. Demo. Definitely need an IDSS. Save and close. And that's been updated. Now, for ease of use, we've made it so that you could collapse if you don't want to actually look at all these. It can be a little confusing to have them all on one page. So these are last year's submissions. Down below are the 2018 requested submissions. So these are your requested submissions for this year. And what we can do is we can now collapse and just see what we requested. Now, if we needed some new submissions, we'll show you how to do that. You just simply click on New Submission, pick your product line. Once you pick your product line, it's only going to show you the reporting products that you have provided enrollment for. So we only have Medicare HMO. Our submission type, we're going to make this an SMP. Once we pick SMP, your special area would be your plan ID, and those are all listed here. If you don't see your plan ID listed, please contact your NCQA account manager so we can have it added for you. And then what's your special project would be the type of plan, and then you would have to include the contract number. And then your audit firm. Once that's done, measure logic in that vendor. And of course, you need an IDSS because it's a Medicare submission. You're going to save and close. And it's telling me it doesn't like my contract number because I don't have enough digits. So I'm going to add that extra digit, save and close. So now my new submission is going to be listed. I have to say how many I want to see. And so as you can see, it says sub ID to be assigned. Now, the sub IDs are listed and are soon to be assigned sub IDs are listed. If at any point we have requested a sub that we no longer need or we didn't need, or we want to make changes to that sub, we simply click on the link at this point. We can edit the submission, go into it and make whatever changes, or we can delete the submission. We don't want the submission. We're going to say delete submission. It's going to give you all this information to make sure this is the one you want to delete, and you can say delete. Once you do that, the system will update that, and that sub will now, because that was a prior year sub, it's going to be listed up above with a no at this point. So at any point, if that was a mistake and you wanted to put it back, you would just simply open the top back up there to show you all the subs from the prior year, and you would open that back up and re-request it. Now for subs that were brand new, don't have a sub ID, if that was a mistake, go down, you delete the submission. That's the one you want to delete. Yes, it is. And as you can see, that one goes away. You can't bring that back because it wasn't last year. You would have to create it again if that was an error to delete it. So previous subs versus brand new subs. Brand new, you have to create again. Previous, you can just go back up to the top and request it again. The last thing that we want to make sure you understand is that if your sub is not listed here under the 2018 requested HEDIS submissions, you will not receive a submission ID in April. It will not be an IDSS for you. So you want to make sure that all the subs that you need to request or want are listed here. So we can check and make sure everything's listed, and we say that everything's done. So we'll move to our next section, which is review. Okay, so we are moving on to our next step, which is review. And we're just going to click the review tab up top, tab 5. And what you see is the review of the application or your HOQ. On the left, you see what NCQA currently has for you. And on the right, under application information, we see what you made changes to. Now, each section can actually be collapsed and it'll take you to the next section, so you can go section by section, opening or collapsing it. If you want a report of everything that's listed on your application information side, you can click on the PDF version, and that's going to open up a new window and bring up a report for you with all the information that's listed in your HOQ, all the information about what this report is, and everything that's in the system as it is in that report. Now, as you make updates, of course, this report will update as you go through. But we're going to close this window out, go back. Now, if you only want to see things that were changed, you can just show only the fields that have changed, and then you'll see what they changed to listed here. If there is anything new, new contact or a new product line, you won't have anything over on the current information because it's new, but it will show you that it's new, but with the green new listing beside it. Now, going back to showing all fields, just wanted to show if there's some kind of way that you went through without updating first year era, it's going to show in red. And to make changes to anything that you see, you just simply click on the edit box here, and it's going to take you to the page that update needs to happen on, and you can make your changes there. And so we're going to put in a website. Oops, not an address. Org. All right, and then now that we have a website, we can save our changes. That's been updated, and if we go back to review, we can see now that there's been a change in what it was changed from and to, and all that information will be listed there for you. Anything new, as I said, would be listed on the side, and you can make changes to those as well. If you need to make changes, you would actually have to go back to that section to change those things. So once you review everything and you're satisfied with the way things look for your update, You can now go on to your next steps, and that's going to be our documentation and our finish page tabs. Okay, so we've moved on to our next tab, which is documents or upload and download documents. This page simply, there's no upload for HOQ, no need to do any uploads there. But for downloads, what we have is a list of the correspondence that's been sent out for HOQ this season. So you have the CAHPS scoring component information, as well as the kickoff letter that was sent out, and the information on the IDSS user fee. Um, so if you have any questions, you lost your documents or whatever, you can always come to this section and get that information. So we're going to move right on to our last section, which is our 7th tab, and it's our finalization tab. And once we click it, it's going to do our final validation on what we've done. So works the same as it did in prior years. Red means that you have issues and errors that have to be corrected before you can go any further. The yellow is basically a warning. Warnings don't prevent you from finalizing, but we do need you to review that to make sure that's what you want to send to NCQA. Now, when it comes to, as you can see down here under the helpful reminders in yellow, it shows that our products, our enrollment for certain states haven't been updated. Now, just want to note to you or make you aware that yes, the system will allow you to finalize, but what's going to happen is you're going to receive a call from your NCQA HEDIS account manager letting you know that your submission has been unlocked and we need you to update the information, that enrollment information, and resubmit it to us. So in order to avoid that scenario, you need to go back at this point and update your products. And when you go into the link here, it just takes you back to the page that you need to update. So you would go back and update that information. And once you do that, you click on tab 7 again, and it'll do the validations for you again. And if I had updated this, these would go away. And there's some other information about enrollment that I need to take care of. But well, let's go up to the errors. So we have an error in our submission and it's unaudited. So the CAHPS only that I did, and it says that it should be not required. But that's not the case. The submission itself needs to be audited. So I would not go back to products here, but I would make a change in the submission. So if I go back to my submission page and go to that submission, I would change that to audited and put in what my auditor group is to get that error to go away. And then under submissions, as you can see, it's saying that I haven't had my survey sample updated or validated by my auditor. So at this point, I would have to contact my auditor and let them know that they need to go in and do their validations for me so I can get rid of these error messages and move on. So what I'm going to do is contact my auditor and have them do that, and we'll rerun this. Let's do that now. Okay, now that I've contacted my auditor, had them do their updates, I'm going to click on my Finish tab again so those validations can be rerun. And now I don't have those errors, but I have one more that's talking about my Medicaid POS product. It says that I've selected adult CAHPS to be scored, but I haven't requested the submission to include that for the POS adults CAHPS. So now I have to go back to my submission and under my Medicaid POS product and request the submission for that. So let's go back and do that. Since that was the new submission, I had deleted by accident, so I need to request that. So I'm going to go back, click on new submissions, and do my Medicaid POS. Didn't have a special area or anything. I do have an auditor. Need an IDSS. And adult CAHPS was selected, so I have to say yes. And pick my vendor. And once I do this, I'm going to have to contact my vendor because if I run my validations again, it's going to give me an error message because it hasn't been validated yet. So I've requested it, but oops, forgot my submission type. And this, of course, is NCQA programs. And I have to say no to the child CAHPS. Now I can save and close. And as we can see, let's see, we'll collapse this. We have that sub ID to be assigned, which will be assigned to us in April. So I'm going to contact my auditor and have them do their approval again just for this submission, and then I can hit my tab 7 again. Okay, my auditor let me know that they've done their thing, so I'm going to click on this Finish tab again, and it's going to run the validations, and as you can see, I have no more errors. Now, as we stated before, I have warnings, and there are warnings here that I need to take care of in order not to get that call from my NCQA account manager. But just for this training here, we're just going to go ahead and go down to the bottom that says that we can reach the finish line. Our application appears to be complete and valid. And so we would just click here to submit the application. Once we do that, we'll get an email and we will be able to go back, and if we go back, we'll be able to run the report if we haven't run the report already, but we won't be able to make any changes to the system. We get our thank you, and you can get your report right here to get the PDF version of the application. And so that's actually the end of the complete review of the new HOQ tool. Well, we've finally come to the end of our HOQ training session. We want to thank you for taking the time out to view the video, and we hope that you did find it helpful in some ways. As always, if you have any questions, please do not hesitate to reach out to your assigned NCQA HEDIS account manager. You can go through the My NCQA portal, as well as send us an email or give us a call. We are here to help you through this process. So here's to an error-free HOQ submission and the start of a happy HEDIS season.